You want to unmute?
Good evening, everyone. At this time, we would like to call our meeting to order. Today, we will have a meeting on COVID-19 to address our community and our staff and parents. At this time, Ms. Rios, would you please call the roll?
Yes, sir. Mr. Stephen Pierce. Mr. Hal Miles. Mr. Kenneth Pritchett.
Here.
Ms. Celeste Nguyen.
Here.
Ms. Lois Long. Mr. Bernard Lundy. Mr. Adrian Dance.
Here.
Thank you, Ms. Barrios.
You're welcome.
Good afternoon, everyone that is in attendance on Zoom and also in person. Tonight, we will have our superintendent to address everyone in reference to the community forum. She will also share with us who also will be in attendance, who will be participating tonight. I want to thank everyone for joining us. We will allow our superintendent and participants to go first. After they have completed their presentations, then we will move to our questions and answers with our audience. Okay. At this time, I'd like to turn the rest of this over to Dr. Ppe Martin.
Good evening to all of our stakeholders here with us at Petersburg High School, as well as those in the listening audience. Before we begin, we do want to ensure that everyone is aware that within the chat feature, we have Nestor Llamas and Estella Bishop, who will be doing Spanish translations throughout this evening's session. We are also recording this session so that it can be shared with those who were unable to be with us this evening. Okay. So our goals for this evening's COVID-19 Community Forum include really two parts. The first is we want to share information regarding the following. First of all, is we know that in the Commonwealth of Virginia, there is a law that required all schools to open for in-person instruction. We will also share some of the COVID-19 data, including vaccination data for the Crater region. We will also be sharing some of the mitigation strategies that we have within Petersburg City Public Schools. And then we also have with us from the Crater Health District, the Deputy Epidemiologist, Courtney Ayers, who will also be answering some very specific questions that we have already received from the community. And she will be able to respond to those questions this evening, as well as possibly others. And then, of course, our goal is to hear from you all, our stakeholders, regarding the opening of schools and COVID-19. These are some of the questions that had already been sent to us that I have shared with the Crater Health District. So Courtney Ayers should be answering these 4 questions, as well as other questions that we might have. The first is, how does the Crater Health District monitor confirmed cases and close contacts? What is the definition of a close contact in classrooms based on VDH guidance? Why are close contacts asked to quarantine for a certain amount of time? She will give us a description of different options. And finally, what does high transmission in schools mean? So I will go through the presentation, but please hang in there because Courtney Ayers will be responding to these very specific questions after my presentation. We just want to remind everyone that Governor Northam did sign a law. And as a matter of fact, last week, he announced that all Virginia school divisions had officially opened for full in-person instruction, which was the intent of the law. And all school divisions in Virginia have complied with that request. That law happened to be Senate Bill 1303 that the governor signed that required each school board and school division to offer in-person instruction to students 5 days a week with some exceptions. This is the actual law that the governor signed. And of course, it has a lot of different details. I'm not going to read this to you, but this is a piece of legislation that we have had posted since before the beginning of school, just to outline why we have opened school for in-person instruction. Also, we have kept up with some of the media reports regarding the opening of school. This is an article that came from the Richmond Times Dispatch, in which they shared that yes, Virginia school districts have some power to halt in-person learning if transmission is high. But again, they would have to do that in consultation with the state as well as their health district, which in our case is the Crater Health District. Also, we know that lawmakers did leave some flexibility there, but it is to close school buildings, not entire school divisions due to COVID-19. And also in that article, it was shared that schools or divisions who do not follow this state law could see themselves losing state funds. So again, we pay attention to the media reports of what is being shared regarding this law. This is some data that was pulled off of the VDH website. And this was pulled yesterday, September 26th, in which we have shared the number of COVID cases for each of the localities in the Crater Health District, as well as hospitalizations and the number of deaths. Again, these are all by localities that are within the Crater Health District. And of course, as I said, we do have with us, let's back up here. We do have with us our partner from the Crater Health District who will be able to share more about this data. Next, we have pulled from the VDH website the data as of yesterday, which was September 26th, for cases, hospitalizations, and deaths for 19 and younger. So this is very specific to the age group upon which we would have students in our schools. You can see what the cases have been since COVID-19 started until yesterday. You will see the number of hospitalizations in the Crater Health District for the same age groups. And you will see that luckily we have continued to have no deaths in this age group. Also, in today's Progress Index newspaper, it was reported that Petersburg new COVID cases have actually fallen 11.9% over this past weekend. So again, we do monitor what our media accounts are saying regarding our COVID-19 cases, not only in the city of Petersburg, but also in surrounding areas. And this was a bit of good news in the Progress Index today. This happens to be the most recent vaccination statistics, not only for Petersburg, but also for the other localities in the Crater Health District. Again, you will see that we do not have many of our citizens who are younger than 18 years of age who have been vaccinated. But this is also data that we continue to monitor very closely as we continue this process. As we have talked about before with our community, we are working to maintain safety and good physical and also emotional well-being. And here are some of the things that we have in place that I will touch upon this evening. Of course, some control measures, some hygiene practices that are also preventative in nature. We have vaccines and testing efforts. I'll talk a little bit about that. Triaging and monitoring for symptoms. Also, any sick space or isolation areas in our buildings. Having adequate supplies such as PPEs, training and staff development, which we had for all staff here in the school division on September 1st. Again, the training was around good mitigation strategies as we enter the buildings. And then, of course, you can imagine we are maintaining a lot of records and documentation and logs to monitor close contacts as well as confirmed cases. And I will talk briefly about that as well. So we know in Petersburg City Public Schools and really across the Commonwealth of Virginia, masks are required. We are continue to work with our students each and every day as we go into schools. We will say mask up for our students to ensure that they are wearing their mask, except for when they're eating, in all honesty, or drinking. But we expect them to wear those masks. Also, if you've been in our schools or if students have shared with you what they see when they walk into their classroom, all of our desks should have a desk shield. This is an extra layer of protection that this school division has put in place to, again, put the extra layer. We know that in some cases, the 3 feet apart is not feasible. So we have added the desk shields on every single desk in every single school. If for some reason your child says, I don't have a desk shield, that needs to be reported to the school administration so that can be put in place. And then, of course, as students are walking down the hallways or entering classrooms, they will have hand sanitizer that we will ask the students to use entering and exiting different spaces. This is just a little bit of the PPEs that we started the school year with. Actually, I have many lists of PPE inventory that we have on hand as we started the school year. This just gives you one list specifically focused on masks and gloves, desk shields, and so on. As far as air quality and cleaning and disinfecting, we have several things that we have put in place as mask disinfecting. So we have air purifiers in all of our classes as well as our offices. We have told our staff, if for some reason you need that filter changed out, please notify your school administration and someone will get that to you so we can have a change in that air filter. Also, as has been publicized, we purchased UV ray lights, which disinfect, as well as electrostatic sprayers that have disinfectant in them, and the whole room or space is disinfected. So all of those things are in place as well, especially for high contact areas such as desks, countertops, doorknobs, etc. So those things are in place as well. Also, as we've talked about before, we have an isolation room in every single one of our school buildings, as well as at Blandford. So if someone is feeling symptomatic, they have a room that they can go to. The nurse does tend to them, but the request is made that they head home and hopefully get a COVID-19 test as soon as possible. But we do have isolation rooms in all of our schools. And of course, quarantining is in place for students and staff who come in close contact with someone who has tested positive. And then also we ask that those who have tested positive for COVID-19 isolate. Those are two very different events, isolating and quarantining. And so tonight, as we talk with our Crater Health District partners, they will bring some clarity regarding the differences and possible time periods for isolating and for quarantining. But it's been made very clear by the VDH and the Virginia Department of Ed that we are to quarantine students who come in close contact per the definition that has been given to us. And we'll talk more about that shortly with our Crater Health District partners. Also, we cannot say enough about having vaccines available and COVID-19 testing. We are fortunate to have a school division in which both of these are available within Petersburg City Public Schools. We have the Crimson Clinic here at Petersburg High School, one of the few health clinics in a high school, but that is a location where vaccinations and immunizations can happen on site. And so, of course, you can call, you can make an appointment, but right here within our school division, we are able to have a health clinic where a COVID-19 vaccine or an immunization can be distributed. Also, we have worked closely with the Petersburg Health Department, the Crater Health District, here in Petersburg, because we know that immunizations and COVID-19 vaccines are provided every single week. And again, these are things that can certainly be provided, or you can certainly make an appointment to receive that. We have COVID-19 testing within the school division of Petersburg. This is just a schedule. We get schedules every week where we first started testing on Wednesday and Thursdays. Then we switched to testing this week on Tuesdays and Wednesdays so that we will be able to get those test results back in a timely manner. But we do COVID-19 testing every single week in all of our buildings. And I will say this past week, we tested over 400, that including students and staff. And actually we had only one positive case. So that was encouraging for us as we continue to watch our confirmed cases. Also, we had all of our employees sign an employee expectations and acknowledgement form that they gave to their immediate supervisors. This particular document is where they had to commit to, if they're not feeling well, or if they are running a fever, they let us know. And then there are certainly, if they need to feel like they need to quarantine and get a test, those things are encouraged and supported. So that is something we do as well. And of course, as many of you know, we have a new COVID-19 data dashboard on our website where we report all of the confirmed cases that we receive, either through our internal testing program or from staff and students letting us know and sharing that documentation with us. This is a screenshot of what that COVID-19 dashboard looks like. And of course, it's already been updated since this screenshot was taken. But it is updated regularly, and you can see the date that it is last updated by school. And just a reminder, we currently have about 3,861 students enrolled in our school division. So when you look at our COVID-19 student cases, that gives you a comparison between the number of students enrolled and then the number of confirmed student cases. So that is just something to think about as we think about high transmission and so on and so forth. Keep in mind that our enrollment is lower than it has been in the past, as I said, I think last week, but we're continuing to monitor these enrollment numbers in light of the fact parents are making other choices during this pandemic. School nutrition, we have continued with our current meal plans. And what we're doing now is that our school nutrition staff, they are using tick sheets. So our students are never touching a keypad to put in any of their lunch numbers. And some of our students are eating in their classroom behind the shields or eating in the cafeteria if we can social distance in the cafeteria with a schedule that works for the school. And then, of course, we always have schedules on hand if we need parents to pick meals up because they have been quarantined. So, but we're continuing to provide meals. We are continuing to provide transportation, but just as I did at the school board meeting last week, I want to thank all of our parents for bringing children to school and picking them up. We made that request, and at any given school, we have over 200 cars that are coming through to pick up and drop off. We are continuing to increase our number of bus drivers so we can run as many routes as we possibly can. Currently, we have about 25 buses that are deployed across the city of Petersburg. The CDC and the VDH did not give us any mandated recommendations regarding social distancing on buses, but we are working hard to do that when feasible. And of course, we're asking all students and staff to wear masks on the bus, as well as opening windows when possible and cleaning the buses after each run before the next group of students get onto the buses. And the transportation team, they also have the disinfectant with the sprayers as well to spray down after a run. We have additional supports during this time because we know it's a very challenging time for all. So we're including a lot of our social and emotional learning lessons that have started. Our school counselors have started their introductory lessons this month. And we have behavioral specialist support that we have increased. We also have mindfulness strategies this year. And then for staff, we are continuing to do Wellness Wednesdays, which has some self-care sessions. We are continuing to offer the Employee Assistance Program. We hope to have a fall fitness program this year for staff as well. And then, of course, the Superintendent's Advisory Committee will start soon, in which each school has representatives that meet with me to get feedback on things that are going on at each site, so we can hopefully address any concerns that we have from staff. So, as I said earlier, we know that the legislation does talk about school closure. It does not necessarily talk about division closure, but we are prepared to do that if necessary as we work with VDH, Crater Health District, and the state if we have to shut down an entire school. So that is something we prepared for actually this summer if we were to go in that direction. And of course, as I said, we had to prepare for school closure if that were to happen, or even classroom closures. But again, we would work with the Crater Health District in making those decisions, especially if we're closing an entire school. And so I think this might be a really good time for us to get some words, Chair, from the Crater Health District. I have shared a lot of what we are doing here in the school division, and this is not everything, but I have tried to hit on all of the major mitigation that we are doing to combat this pandemic and keep folks safe. And Ms. Ayers, are you still with us?
Yes, can you hear me?
Yes. So
Perfect.
Everyone, this is Courtney Ayers. She is the Deputy Epidemiologist for the Crater Health District, and she is prepared to answer these questions that are posted in front of you, as well as other questions that all of us might have. So is it okay, Chair, to turn it over?
Yes, move forward, please.
Okay. All right, thank you so much, Dr. Petrie Martin. So the first question about how the Crater Health District monitors confirmed cases and close contacts. So COVID-19 is a 24-hour reportable disease. So all labs and providers are legally required to report any positive cases of COVID-19 to their local health district. And also in combination with the schools also help report new cases as well. And once we have a confirmed case, we reach out to that individual and investigate their case. And in that time frame, we explain to them what a close contact is and kind of help them work through when they would have been infectious and decide how many close contacts they have. And then working with that person, that individual that was positive, we are able to work through their close contacts and reach out to those people to follow up with proper quarantine measures. The schools play a really large role in close contact and contact tracing, because they have seating charts, bus charts, they know what classes kids are in and what activities they're doing. So we work in conjunction with the school. They do the heavy lift for the contact tracing within the schools, just because they have all of the materials to determine who's a close contact. And the definition of a close contact for students in a school setting is a little bit different than in an everyday scenario. So there's a close contact definition for student to student, which is 3 feet, greater than 3 feet wouldn't be considered a close contact. So anything less than 3 feet, when both students are properly masked, would be considered close contact. So the 3 feet rule only applies student to student when they're both properly masked. Anytime one person in that group isn't masked, it would be anything less than 6 feet would be considered a close contact. And then also from student to staff, it's always going to be anything less than 6 feet that would be considered a close contact. So when the school's working through their contact tracing, they look to see that everybody's appropriately masked. And if the students are appropriately masked, then anybody less than 3 feet from them would be considered a close contact. And then for student and staff, the masks don't play a role. Anytime a student or staff, and it's a cumulative of 15 minutes or more. So if you're only seeing somebody for 5 minutes, that's not considered close contact. So it's 15 minutes or more over a 24-hour period. So if you spend 5 minutes there, 5 minutes there, and 5 minutes there in a 24-hour period, if it adds up to 15 minutes, then that would be close contact. And then any other time where respiratory droplets are shared, there's no time limit on that. That would be considered a close contact. So if somebody coughed or sneezed or kissed, that would be considered a close contact. The next about quarantine. So people that are in close contact with somebody that tests positive, they are required to quarantine. So once you look at that definition of what is a close contact, you would then determine which people would need to quarantine. So the gold standard for quarantine would be 14 days, since science has shown that you can it can take up to 14 days to become infectious once you come in contact with somebody with COVID-19. So there is kind of some confusion sometimes if your household member is the person that's positive. So if you are unable to completely separate from your household member that is positive, then you're continuously being exposed to that person each day while they're infectious. So since people that are infectious have to serve out a 10-day isolation period because they're infectious to other people, that other person in the household is going to have to quarantine while that person's infectious, so that 10 days, because every new day they're being exposed again and again and again. And then once that person's isolation period ends, when they're no longer infectious, they can then start their 14-day quarantine after that. So that ends up being a total of 24 days, which does get confusing for some people, but it is because they are having that continuous exposure where every day they're being re-exposed. So every day their 14-day quarantine would start over to day 1. So that's why they have to serve out the whole time with their positive household member and then their quarantine. And I can, if anyone has any questions when we get to the questions about that, I know that part can be a little confusing. And then lastly, about what high transmission in schools means. So there's no set definition right now for like what is considered high school transmission, because it takes in quite a few factors. So we would be looking at the amount of outbreaks within the school, how large the outbreaks are, whether or not they're focused to certain grades, for certain classrooms, and then also looking at school absenteeism rates. So we kind of look at what the baseline is every year. So, every school has a baseline. Some it's like 10% is normal. And once you start seeing really above that threshold for the baseline would be when you would start to be concerned. And then lastly, the staff capacity, whether or not the school can effectively run with the amount of staff that they have out. So if there is a high number of staff positives or staffs that are quarantining, then that would also go towards, looking at that high transmission in schools. So it's a combination of factors that we look at when determining whether or not being affected by COVID-19. And that's what I have for those questions. So I'm happy to dive deeper into any of them or any other questions.
Mhm. Mhm. Go ahead.
So, Ms. Ayers,
You're still on mute. Yeah.
So, Ms. Ayers, there is a great question that has been posed in our Q&A. So I'm going to read it. If we are contacted and we as parents take our children after 5 days to get tested, if the child is not positive, why can't they return back to school? And of course, I totally agree. It is difficult to help a child that might have, IEP or 504. And anytime a student is out of school, it's a disservice. So if we are contacted and we as parents take our children after 5 days to get tested and they are negative, why can't they return to school is the question.
That's a great question. So we say the gold standard for quarantine is the 14 days. And that's, always what VDH is going to recommend doing the full 14 days. However, we understand that there comes times where using a shortened quarantine is in the best interest of the scenario. So it is up to the schools what forms of quarantine they want to use. So there's two other options that both CDC and VDH does acknowledge, and that is the one that was stated in the question is getting a negative test anytime after day 5 and returning after day 7, or 10 days without symptoms and returning. And then obviously the 14 being the gold standard. So all three are recognized options by both VDH and the CDC. And we do leave that up to the school to determine what options work best for their school system.
And Ms. Ayers, if we make some changes in that, I know you had helped us write the first quarantine letter. Would you also assist us in messaging if we should choose to shift that?
Yes, of course. Because we do recognize the burden that it is for people to be out of work, school, whatever, for 14 days. But as long as understanding that the risk still lies if you do less than the 14 days. The risk is minimal comparatively, but there is still a risk that lies with doing less than 14 days.
And that is for quarantining, correct? Is there any difference for isolating?
For quarantine, correct. Isolation, so people that are positive, it's always going to be 10 days. That's what both VDH and CDC recommends, 10 days from the beginning of symptoms, as long as by after that 10th day, you're fever-free for 24 hours, not taking fever-reducing medications, and your symptoms have improved, because some people do have the lingering loss of taste and smell, unfortunately. So it's always going to be 10 days for isolation.
Okay. You said Ayers, right? Miss Ayers?
Yes.
Yes. Miss Ayers, could you, I'm not sure, I had moved away for a moment, but could you share when should we quarantine an entire class? Because let's say that Johnny is sitting beside a student and Johnny ends up positive. Do you quarantine the entire class or do you quarantine the student that was close contact with Johnny?
You would look, in front, behind, to the sides, and you would decide if A, making sure everybody was properly masked, but B, once you figure that out, you would look around and see if there's anybody in that vicinity that was less than 3 feet. And if the answer is yes, then that 1, 2, 3 people around, because we do realize in some of the school settings that space is more limited and that kids do sit closer than the 3 feet. So in that case, the few people that are less than 3 feet around them would have to quarantine. If you can identify everyone is greater than that 3 feet, then you wouldn't have to quarantine anybody. If it's only 1 or 2, because there was a few people sitting next, you would quarantine them. The only time you would do like a whole classroom is if like you potentially have multiple people testing positive, you don't know who's spreading it to who, and you're having trouble assessing close contacts or people weren't wearing masks very well. That would be when we would start to consider quarantining an entire classroom. But on a normal basis, no, we wouldn't quarantine a whole classroom.
Thank you. Thank you for that. We're going to move around, but before we move to our audience, we're going to move around to board members and see if they have any questions for you. I'll start with Mr. Dance.
Good evening, everybody. I don't have any questions, Mr. Chair.
Thank you. Ms. Long. Can't hear you.
Can you come back to me?
Mr. Lundy.
Yes. I noticed that we've had a couple of incidents where different time lapses have been given for being away from school. And I did hear that it was said that we leave that up to the school. So is that causing will that cause a great interference for our parents and our students as well? Because one thing happens, once you give that time factor, then you have to also put in the fact that how is that child going to be, he or she's going to be educated? And so I heard one thing last week about a parent, about a child. It came up 10 days, then it went to 14, and then we had a situation where somebody was talking about 28. And that was very confusing.
So, Ms. Ayers, do you want to take that? Because it appears that a 10-day was given for isolation. A 14-day was given as a recommendation for quarantining. And then there is a 24 or a 28. And Ms. Ayers, we need you to clarify that for us, for those who might have had multiple contacts. So we absolutely agree. You know, we need to make it as clear as it can possibly be.
Sure. So every time somebody has close contact again, their quarantine would get potentially pushed back. So if you came in contact with somebody today that was positive, you would be asked to do at least the gold standard would be the 14 days. So if we're saying 14 days, you would be asked to quarantine for 14 days. But if the next day, if you weren't quarantined and you came in contact with somebody else that was positive, that would also put your day back. But what I'm thinking is probably happening for this is that person, their close contact was a household member. And that was what I was trying to explain earlier. Every day that you're with your positive household member, every day that they're infectious for that 10 days from the start of their symptoms, or if they're asymptomatic, 10 days from when they got their lab test done. That's when they're infectious. So every day you're in that household with that person, you're getting re-exposed each day. So every single day is a new exposure, and that's going to happen for that 10 days. And then after that, you're finally no longer being exposed and you can start your 14-day quarantine. So it does end up making that person's quarantine 24 days. That would be the only time that you would have a really extended quarantine. If you're able to completely quarantine away from that positive member in your household, if you don't share bathrooms, if you have your own separate room, you won't be re-exposed every day and you can do the 14 days. But it's if you're still having contact with that household member, you're still having to share a bathroom or share a bedroom or something, that you would be end up doing that 24 days. 28 days would never be something that is suggested unless your days were getting pushed back because you were exposed to somebody else. So most likely it's either going to be you're quarantining for the 14 days or the 24 days if it's a household member, unless your school decides to do shortened versions of quarantine.
Thank you. We'll move Ms. Nguyen.
She actually answered my question in her presentation.
Okay, thank you. Mr. Pierce.
No questions at this time.
Okay, back to Ms. Long.
Yes, my question too.
It's already been answered. Okay. Okay, Ms. Ayers, we're gonna get ready to open it up to our stakeholders. We're going to ask if you have a question that you would please raise your hand and we will let you in.
You have some.
Okay, let's go with Roland Edmonds. Roland Edmonds.
Three minutes. 3
We
minutes.
should, it's depending on the number. I would hate to say it. I mean, we're going to be here. We're going to be here at least until we're given a time from 6 to 8. Just want to make sure that everyone leaves well informed. I can't hear you.
Yes.
Excuse me? Excuse me, can you hear me? Can you hear me?
Yes, ma'am.
That's me. I'm sorry, I was on mute. That was me. I can hear you.
All right, the problem was today, my granddaughter was picked up from school by somebody's the name that was not listed on the list, that was not authorized to pick her up. I want to know what the school policy is with that. And let me explain to you what the situation is. The situation is that the mom and dad is going through a custody battle. They are not married to each other. And his name is not on this list. He should have not been able to pick her up from school. They turned her over to him. My granddaughter ended up in the emergency room, blood pressure upset because y'all let her child go with somebody she wasn't supposed to be with. And now they're telling her that she can't get her child back. So what is the policy?
Ms. Edmonds, can you share with us which school it is?
It's Westview.
Okay. The superintendent is writing that down. Dr. Peachman, you want to let her know what you're doing? What we'll do?
So it would be very helpful. Can you hear me?
Yes.
It would be helpful if possibly we could get your contact information, because no, that is not our policy. And so I need to dig into this deeply to investigate what happened.
I can give you a whole lot of information there. The mother's
No,
dead.
ma'am,
Okay. Okay.
if possible, if there was some way to get maybe your contact number, because the name here says Roland Edmonds, and we might be able
He's
to.
right there.
Yeah, she's using my phone. I'm sorry.
Oh, okay. All right. So I just want to, okay. So it would be helpful for us to at least, it would be helpful for us to get some direct contact information, so that we can definitely call you. We want to hear your concern. I just want to make sure that I know who to contact in this instant. Would it be possible, Mr. Edmonds, to send me a private chat with the telephone number?
Yes, I can send you my telephone number, and also I can send you my daughter's telephone number, because she's the parent of my granddaughter, and she just got out of the hospital because her blood pressure went really high because she's afraid that he may take her and not bring her back. So,
Mr. Edmonds,
yes.
could you please put the number in the chat for the superintendent? We would prefer that you do not discuss that information over Zoom.
All right.
Is that it?
I'm putting it in now.
Okay, we appreciate it.
Yes, sir. And I have it open, so I'll get it the minute you send it to me.
Okay, thank you.
I sent my number.
Okay.
I have it, sir. Thank you.
Okay, next we move on. Looks like is it Tiaja, right? Miss Wright? Miss Wright, can you hear me?
Mute.
Miss Wright?
Can you hear me?
Yes, yes, we can. Go ahead.
I was muted. Hello, how is everyone?
Just fine.
Good, good. My question is, my son was quarantined, probably the third or fourth day of attending school. Every day I've received a text, a phone call and text message saying that another student and a couple of teachers had tested positive for COVID. I have encouraged him to go on the Chromebook to see if he could find assignment to complete, to keep up to par with the assignments. I've also been receiving calls every day saying that he's been marked absent. I would like to know what is being done for these students who are being quarantined and isolated to keep up with their assignments while they're at home. He was not able to even log on to his Chromebook at all, nor was he able to email any teachers. And I don't want to have to go through what we went through last year when he was on virtual. We ended up with a truancy officer, and my son, he was having major problems signing in, logging on. And I know for a fact that he gets up every morning and tries to get into class. He's still trying, he's still home. I do not feel comfortable sending him back home. Sending him back to school. Every day I get a call. So what if he goes back to school, goes to class, another student tests positive? Will he be sent home quarantined again? Like, how often are we going to have to deal with this during the school year? I know you guys are doing everything you can to keep these kids safe, but this COVID thing is just out of order. And I feel like it's really stress-filled. And being that I am diabetic, I really feel uncomfortable. I spray him down with alcohol and I have sanitizer for him to come in the door, because I have started my vaccination. He has not. What do we need
So,
to do?
so Miss Wright, are you talking about a high school student?
Yes, sir. He
Okay.
attends the 11th grade high school student. Yes, sir.
Okay, we'll have the superintendent to answer your question.
All right.
So good evening, Miss Wright. How are you?
Good evening, Miss Martin. Miss Martin.
So, yes, Miss Wright. This is definitely a challenge. So it sounds like he has completed his quarantine period. Is that correct?
I'm assuming so. Yes, it has been more than 14 days. But
Yes, ma'am. Yeah. So it is true that if he has completed his quarantine period, he is being marked absent because he has, the expectation was for him to come back to school at the end of the quarantine period. So that's why you are getting the absences, because if it's time for students to return back, then absolutely they are being marked absent. And so I think we really, really need to have a discussion with you one-on-one, because it is the expectation, if the quarantine period is over, that they return to school and virtual is no longer an option for them at that time.
Just interrupt you 1 second and let you know that I started receiving the calls of him being marked absent the very next day that the nurse called me and quarantined him. Okay. I have been receiving, and I called her back and spoke with her personally, and she told me to ignore it because it had not been able to, because things are happening so fast that you were not able to revise the school system that calls to report that the student was marked absent. The very next day, he has gotten I have gotten a phone call at least 2 to 3 times a day since the very next day that the nurse called and quarantined my son. So it didn't just start
Okay.
after the vaccine, yeah.
Okay. So in all transparency, we are going back through and checking all of the attendance markings for quarantine students at every single school,
Okay.
because
perfect.
they should not have received an A, they should have received a V. And so we are going through that process because you're not the only parent we have heard from in regards to that. So thank you, Ms. Wright, for clarifying that. I was under the impression it was after the quarantine, but if it was during, we're going to go through and turn those absences to Vs
And what does
in
B
the
mean?
system. V means that they were either remote, meaning they were not on campus and they were asked to quarantine. So it's not considered an absence.
I'm sorry, I got a phone call and it muted you out. I'm sorry. What did you say?
It is not considered an absence because they are remote due to
Okay.
quarantine.
Okay.
But that is only for the 14 days that they're in quarantine. Yes, ma'am. So all of our schools are going through that process to make sure that we are straight from that perspective.
Okay. So he should return to school tomorrow.
Yes, ma'am. We would love to have him. And you are indeed correct. If the student does come back to school, and we hope it does not happen, but if he becomes a close contact, he may have to quarantine again. And this is a very unfortunate process, but it is the process that we have to try to maintain school as long as we can.
So what is being done about their assignments? What are
right? So one of the things that we have attempted, but obviously we need to do a far better job, is to ensure that there's some type of information in Schoology for the students to be able to complete their work, and also a Zoom link to be able to receive some direct instruction during the school day. I just wrote your name down because what we're going to have to do is very much what we did last school year. So what happened is that if someone could not get on virtually, we would even do home visits to make sure that folks could get on virtually and get on to Schoology. So I think we need to have a process in place for that to happen, but that is the plan that we have. Also, we have told all of our staff that our students should be allowed to make up any work that happens during that quarantine period. We have shared that as well. So
how do I go on? How do I go on and get him get that process going for us, just in case it happens again? I do not want him to fall behind. This is his last 2 years. And he may come back to school tomorrow and get quarantined again. So that's going to be another 14 days he's behind. So
when he returns, I'm sure he'll have his Chromebook with him. When he returns. So what we can certainly do, and you said Petersburg High School.
Yes, ma'am.
What we can do when he returns with that Chromebook is I will make sure his name gets to Principal Fields so we can take a look at his Chromebook and see if there are any barriers to him using Zoom or getting on to Schoology. So I have written that down and we will follow up. He might need a new Chromebook as well. So we'll take care of that. He just needs to bring it back when he comes back.
When he comes back, who does he need to see about it? I
think if he could just report to the office, because I'm going to share this with Principal Fields.
All right, report to office with Chromebook. Okay, I will instruct him to do that tomorrow.
And I'll follow up with you as well, Ms. Wright, because I'm sure I have your contact info in Power School.
I will. I have a new phone number. I'm not sure. I'm receiving calls, so maybe it is, but I will send my contact information as well as my email address to you through the chat. Is that good?
Yes, ma'am, because I'm monitoring the chat as we speak. So yes, ma'am, that would actually be good for me.
I'm going to do it right now while we are talking so that you can say that you got it. Tap here to chat. All right. And I just want to salute all of you guys that are really pushing this and trying to keep everything up to date and keep our kids safe, keep us safe, keep you all safe. And as long as we stick together, I hope everything works out for the school year for you, us, and the students. So I really am
Yeah.
praying to all of you guys for everything that you are trying to do to keep everybody safe. I just want to say I am praying for all of us.
Thank
Okay?
you. We need it. Yes, ma'am.
Yes, ma'am, we do. And we have to stick together in this. Technology, I'm giving my name, his name, my email address, and my telephone number. And I'm about to send it on over to you now. You can contact me anytime, Ms. Martin.
Thank you.
You're welcome. You all have a very safe and good night. I'm about to leave the meeting.
Thank you, Ms. Wright.
Yes, sir.
All right.
Again, God bless us all. Y'all have a good evening.
All right, same to you. Okay, next, let's go to Mr. Linwood Christian.
Good evening. Can you hear me?
Yes, we can.
Okay, this is to Miss Ayers, I believe, as well as to the rest of you. I want to play devil's advocate here for just a minute with this question. And it's only because we had a single parent who's in our neighborhood association that came to me with this problem. Now, what if I am a parent that has a child in the school system and we need to quarantine, but because of some legal issues right now, my child and I live in a one-room apartment. I don't have any relatives here. I don't want my child to miss school. So how is there any way, if I should let the school know, I can get assistance maybe in getting some kind of housing or getting my child somewhere where where I quarantine, but the child is still able to come to school? I know it would take me to come up with that, right? But
Are you referring to like the parent was positive and the?
yes,
Okay, so the parent had to isolate.
yes.
I unfortunately, I mean, I don't have a good answer for that. I know it's really hard for people that, you know, do have to share close quarters with somebody else that is positive. Unfortunately, I don't have a good answer for what they should do. I mean, we wouldn't want, I mean, at that point, they have been exposed. We wouldn't really want them to be shipped somewhere else in case
Right.
they do become positive and expose another person. So, I mean, I really feel for that, but I don't have the answer. I'm sorry.
Okay, because and again, because the parent really, where the parent is right now, they don't have anything set up as far as being able for the child to connect remotely. So I was wondering if the technical issue is get up, and I think Dr. Martin, you partially answered my question. You answered my question somewhat with the last parent. Instead of being marked absent, the grade will be a V.
Mm-hmm. Yes, sir.
Okay. Now, one last question. Am I right that there is some Petersburg Public School hotspots throughout the city?
Yes, sir. There are, and actually, depending on the school, they can
Right.
just check with the front office at the school, and they can receive a hotspot. Yes, sir.
Okay. Okay. Thank you. Thank you.
Thank you, Mr. Christian. Okay, next we will move to, I believe is it Taron or Taron Green?
Yes, I'm Taryn Green. I'm Tyron's mother. I have
Okay.
a question about virtual learning students. They have to come to school to take their tests, and I would like to know, I know why they got to come to school and take their tests, but would they be around the other students or would they be around other virtual students? Because I know a lot of tests has come up at his school. Even they called me today about one, a COVID test a student tested positive today. So I was wondering, with him going to school, will he be around those students or other virtual students?
And actually, Ms. Green, we are working on having our central office available for you to be able to come in and test there. And so Dr. Daniels, our Chief Academic Officer, is on the line now. And so if that is a request, we can certainly do the testing in a different building in which there are no students.
For his SOL testing?
Well,
I'm talking about the SOL test will be done at the elementary schools, right?
oh, I
That's
thought you meant the growth assessments, because we are doing growth assessments this week. So I thought you were referring to this week's assessments. Of course,
Yeah, it's
when
this week and it's it is this week and next week for the kids to go to school, starting I think it's Wednesday.
That's
yes,
This Wednesday and next Wednesday.
yes, ma'am. And so we have considered the central office as an option for you.
Okay.
And so, of course, we have no students in that building, but Dr. Daniels, who was on the call, she can work with you to get that scheduled.
Okay.
Yes,
Okay.
ma'am. And yes, the testing site at the school is a secure location. It is away from other students in the school. There are mitigation strategies already in place. Those desks have shields. They are over 3 feet apart. However, if
Okay.
you are still uncomfortable, please let us know and we will make further arrangements with you.
And I have
Okay.
written your name down, Ms. Green, so we can follow up with you as a virtual Virginia parent.
Yeah.
Okay.
Okay. Thank you so much.
Thank you, Ms. Green.
Thank you.
Next, we'll move to Mr. Michael Parham. Mr. Parham?
Yes, can you hear me?
Yes.
Yes, sir.
All right. My grandson told me on September the 9th, I wrote all this down, that one of the students in his room got sick, and later on they determined that she tested positive for COVID. I received a COVID result for my grandson on September the 24th. So we're talking about 15 days. My specific question is, when an individual tests positive and they are with a student, will the classroom parents, the parents from that particular classroom, be notified instead of me finding out that the school had a case? In other words, I don't think that need to be broke down. We're told that there was a case in the school, but later on I found out that the case was actually in my grandson's class, and I believe that when that happens, we should be notified that there was a case. And of course, his test came back on September the 24th. He did not test positive for COVID, but I didn't know about the individual being positive in his classroom other than he told me. And I think there should be another way for me to find that out.
And so just to clarify, Mr. Parham, was your grandson a close contact or not a close contact?
What do you mean by close contact? I just know, all I know is that
Right.
he was in the classroom with the person.
Right.
I don't know how
Right.
close
So,
he was, or whatever. I don't.
right. So our current process, and Ms. Ayers from the Crater Health District discussed it briefly. Typically, we look at what's called a close contact in the classroom. And so the close contact is that less than 3 feet, and they look at wearing masks and they look at desk shields. There's like a couple of indicators that we look at to determine if a student is a close contact. So typically the parents in the classroom, when a student is a close contact, they are contacted, and those are the students who are asked to be quarantined. If you were not asked to quarantine, but I think you might have been, because I think you said that like 15 days or 14 days later, the student tested a negative. So, but typically,
No,
a
I mean,
close, okay.
what I'm saying is that somewhere in there, my grandson was tested. Between the time that he told me that there was a case in his classroom, between
Okay.
the 9th and the 24th, he took a test. I would
Okay.
even like to know when he took that test. I didn't know he was being tested. So I think that that's something that maybe I would want to know.
Oh,
you follow me?
Oh, okay. So, Mr. Parham, I think we have a different issue. Thank you for clarifying, because I was not clear on what you were saying here. So, you're saying that your child had a COVID-19 test in our building,
Yes.
but you were not aware.
Yes. I wasn't aware until I got his results back on the 24th of September.
Okay. Did you get the results back via email?
Yes. I've got the results. I'm looking at it.
Okay. So I think what this is that you must have signed a consent form to have him tested in the school. Okay.
I signed that when they had the event at the the field, the baseball field, doing
okay.
Yeah,
So,
I signed it then.
Okay.
That he could be tested. Yeah.
Okay, so I think what has happened, Mr. Parham, is that now all of the consent forms are now in the system. So actually, your son was probably not tested because of the classroom environment. He has just gotten on the weekly test rotation. So I don't. So he really wasn't tested because of the COVID case. He was tested because he's now on the weekly list to be tested every single week. But Mr. Parham, if that's something that you would prefer not to do, let us know. But it seems like now he's in the system to be tested every single week. Just to clarify that part.
Okay, I want to keep him on the list to be tested. I don't have a problem with that.
Okay.
What I have a problem with is that if one of his classmates test positive, and it's my grandson, if one of his classmates test positive, I think we ought to know.
So let me go back. Okay, so let me go back to that. I was just trying to address kind of the issues in different sections. So the way it currently works and the way we have been advised from the Crater Health District is that we make contact with what is called a close contact in the classroom, not the whole classroom. So again, that is the less than 3 feet. It looks at mask wearing, it looks at desk shields. Those are all and we have seating charts in every single class, so we know where students were sitting. So that's why you were not contacted, because your child was not a close contact to that particular student, even though they were in the same classroom together. Now that is the guidance.
Okay, I understand.
So thanks for your patience, Mr. Parham. I was trying to answer all of your questions, so thank you for your patience.
Yeah. You're okay. I appreciate you. I appreciate you, and I have never had a problem at the school. My grandkids been going there, just both of them for 5 years, and I'm okay with the school and you guys.
Thank you, sir.
But we will keep working at it, Mr. Parham, to perfect all of these protocols. We will keep working at it.
Thank you.
Okay. Next, we'll move to Miss Tina. Is it Brownell? So we can't bring her on? I can't hear what he's saying.
Yeah, he's saying that she has an outdated version. So I'm not sure about that.
I'm sorry, I was muted. Can you hear me?
Yes, ma'am.
Hello?
Yes, we can hear you.
Okay, my question is, as far as like this whole COVID situation, because I am a parent, I was making the decision to send my son to Westview, but I withheld because the whole COVID situation is a little bit too much. It's just my question is like, if this pretty much whole situation gets any worse, will the kids be switched back to virtual?
Okay, the superintendent, she will answer that. She did go over that earlier when she made her presentation. Dr. Peach Martin.
And so, good evening, Ms. Brownell. How are you? So based on what we have been told by the Virginia Department of Health, as well as the Crater Health District, is that we may have a school go back virtual, but the entire division would not go back virtual. And that would only depend if we are a high transmission situation in which the Crater Health District would communicate with us when we have reached that high transmission mark. But we would not have the whole school division go virtual, but we could go virtual by school, and it would have to be if there's high transmission in that school. And then I think Ms. Ayers from the health department might want to review with us again the high transmission and what that means. Ms. Ayers?
Sure. So based on what Dr. Petrie Martin had said, since that General Assembly bill had passed, it does require all schools to be in session 5 days a week. And the exception to that is it can be evaluated at a school level if high school transmission is happening. And that takes into account the amount of outbreaks, how big the outbreaks are, school absenteeism rate. So if there's a lot of children or children that are out, and then also staff capacity. So if there is a lot of staff that are out because of isolation or quarantine. So we would think about all three of those things, look at it as a whole, decide with us, the school, the state, and the Department of Education, whether or not that would be an appropriate move. So that's how we determine school closures.
So Ms. Brownell, we have not gotten there yet, but that would be the process to decide which school would go virtual if needed.
Okay, one more question. I know there are new students that are applying. Would they would be able to do the virtual as well?
So are you referring to Virtual Virginia specifically?
Like newer students that wanted to apply for their child to go to school, would it be a virtual option for them?
Oh, no, not if it is Westview. The pre-K students are not part of the Virtual Virginia option. But as we look at going into the second semester of school, Virtual Virginia is definitely an option for our kindergarten through 12th grade students, but not for pre-K. Did it?
Did we lose? Did we lose her?
Oh.
We must have lost her.
I think she just muted. I think she's still on, but muted. Ms. Brownell, can you hear us?
She's on mute. There she go. Are you back? Okay, we will come back. We will come back. Let's move next to Tiffany Talaferro.
Hello.
Hello.
Hi, everyone. Good evening. I have a question in regards to students that are being required to isolate and virtual learning being made available to them. At this time, my daughter is, I think, 4 days in to her isolation period, and there are no Zoom links except for one class that is readily available to her. Of course, I'm concerned with her, getting behind, but outside of contacting, her counselor, whom I think might be a little overwhelmed, I'm just curious, how should I go about getting assistance with virtual learning?
So Ms. Telefaro, we're going to take it from here, if that's okay with you. I think we have your contact information in Power School. So we need to follow up because we do want to ensure that students have access. So we will follow up directly with you to get that done.
Okay, thank you. I have one last concern in regards to, I guess, social distancing. And I really kind of played with the thought of being open and honest, but I am very concerned about the execution of social distancing at certain times throughout the day. I have seen actual videos of, students of large amounts. I don't know if they're in the gym or maybe during lunchtime, but it seems like maybe they're being dismissed and they are like literally on top of each other. And, considering that everyone in my household is vaccinated, as well as, other family members that we, interact with, I can't say for sure that my daughter contracted COVID from school, but it just kind of, based on what I've seen, it really concerns me that social distancing was in effect at, in the beginning, and I'm not sure if it's being maintained.
Well, that is good feedback for us, Ms. Telefaro, because in schools and enrollments that are large, like the high school or Vernon Johns, it is very, very hard to manage. It would be helpful for us to know some of the exact spaces. I heard you say dismissal. I heard you say possibly the cafeteria in the gym as some key areas that we need to be looking to. Is that correct?
Yes, that's correct.
Cafeteria, dismissal, and gym. Okay.
Yes. Yeah, so I guess that would be a good start in looking into those high populated areas. I don't think that there's a concern for actual classroom or even bus riders. I'm pretty comfortable with those two areas. But again, my daughter is 11, she's unvaccinated, and I mean, I've even started her to wearing 2 masks, for extra protection. And I'm on her about sanitizer in her lunch bag and, otherwise. So, I just want to ensure that, those protocols are being maintained. And I do understand that, there's other developments, that are going to be put in place for just parents being notified of positive cases and that sort of thing. But I know it's been a little bit challenging trying to get a hold of, certain personnel in order to communicate the fact that my daughter was positive and, protocol or, next steps to take from that point. But I understand that everyone's doing, the best that they can. And I do appreciate that. So That's all I have.
Thank you, Ms. Telefaro. And of course, my office number is open as well.
Thank you.
All right, appreciate it. Next, we'll move to Miss Mariah White.
Hello, how everyone doing?
Just fine. How about you?
I'm doing awesome. And you? I have two babies. My oldest go to Lake, I believe it's Lake Mount Elementary, and my youngest go to Westview. When I was like going through Westview policies before school had started, they had mentioned something about you cannot bring lunch boxes. And I recently seen something on social media about the food that is given to our babies. Can you explain to me why we can't pack lunches for them or why we can't bring in food?
So actually, it is really regarding more of fast food items than anything, Ms. White. So because we do receive funding from the federal government for our school nutrition program, we cannot have what's called competing foods in our building during our lunch hours. So that's probably what you heard. We do, have, some students that you might see with the lunch pail, but a lot of it is regarding fast foods. For example, dropping off a Big Mac or order of fries, that is definitely against federal guidelines. And it's because you can't have competing foods in the building during the lunch hour because we are federally funded.
Okay. Are we allowed to pack our babies' lunches and send them to school?
So that is definitely my understanding, but I will put a caveat on that, Ms. White. There might be different Head Start guidelines because in Westview, we have two programs in one at Westview. And I always tell folks that we have the Head Start program that is heavily regulated because it is a federal program, and we have VPI. So I would rather follow up just to make sure that is good with the Head Start portion of the program before I commit to that. But I will tell you for our elementary schools, that is the case. Yes, ma'am.
Okay. Well, I appreciate it. Thank y'all guys so much.
All right, thank you.
And I have your name written down here, Ms. White, so we can contact you via your information in Power School, hopefully.
Okay, awesome. Thank you.
Okay, next we'll move to Miss Tarnisha Rose.
Hello, everyone. Can you hear me?
Yes.
Okay, great. I wanted to say that I share the same concerns that Ms. Green spoke of earlier in regards to having virtual students return to the building to do their standardized testing, whether it's SOL or the growth tests. I'm concerned that these tests weren't looked at differently in regards to how they're administered. I know that there's, software and other things that can be put in place, to make sure that, there's honesty with taking the tests. But having to send the children in for testing defeats the purpose for some of us who have our children learning virtually due to healthcare concerns in the household.
And Ms. Rose, this is actually a state requirement that they take the tests in person. That is not a Petersburg requirement. So we are just trying to follow the guidelines as they have been given to us. But we certainly understand your concern. But if your student is to take the test, they will be asked to do it in person. And the state has said that is the way it should be. So it's not our guideline, Ms. Rose. I just want to make that clear.
Okay, and I heard someone, I don't know if it was you or someone else mention that you have an alternative location that you were considering. My child is scheduled to go in tomorrow, and I'm on pins and needles, like I'm terrified.
Right. So Dr. Daniels is on the line. She's our chief academic officer who works with Virtual Virginia. So she is documenting this information currently. We actually have a window Ms. Rose, in which the students can take their test. So she will be in touch with you to discuss what that could be for you as a virtual Virginia student and parent.
Thank you.
Thank you, Ms. Rose. And I believe Nurse Hamlin would like to speak.
Oh, yeah, okay.
Nurse Hamlin, are you there?
She was there.
There she go.
I'm sorry, I had to step away for the bathroom. I'm sorry. I'm sorry. So I missed the question.
So I think, Nurse Robin, there was a question you wanted to respond to. I know we've been fielding them in the Q&A and in the chat, but I think there was a question you wanted to respond to.
Oh, I just wanted to clarify, and Courtney, you can correct me if I'm wrong. If students or staff are fully vaccinated and they do not have symptoms, they do not have to quarantine. But in most cases, we do not know the vaccination status. And I think that was the question in the chat about having a vaccinated student and how that relates to quarantine.
Yes, that is correct. So anybody that's fully vaccinated, which for children, since most of them have only been able to get Pfizer, that would be 2 weeks after their second dose, they're considered fully vaccinated. They don't have to quarantine unless they develop symptoms. And then also anybody that has tested positive in the last 90 days that gets re-exposed also does not have to quarantine unless they develop symptoms. And as far as vaccine status, I know the schools are able to ask the students if they're vaccinated to help with quarantine. So if your child is vaccinated and get identified as a close contact, you can tell the school that your child's vaccinated and they won't have to quarantine.
Was that it, Ms. Cox? Ms. Hamlin?
Yeah.
Okay. Thank you.
This one there.
Is there anyone else that would like to speak? Oh, I'm sorry. We have a parent, I believe, parent, right? Yeah, you can come over and stand up. They probably will not be able to hear you online, but you can go to him, go to Mr. Corey.
Good.
Good evening. Thank you guys for being here and being patient with us. My concern, however, is for me. I'm a long-term sub here with the school and have been for 5 years. I don't really, okay, so I can hear. I'm sorry. My concern is this. I was exposed in a pod at Vernon Johns. The child was not in my classroom if I'm certain. Now, some things I'm not certain about now that we've been discussing, I probably should have asked. But I'm on my 10th day, I tested and I'm negative. I'm going to take another test tomorrow. They told me that I had to be out for 28 days. I'm not tooting my own horn, but 28 days is a long time for me to be gone. And I know they need bodies there. So my concern is, since we have a young lady up there, do I have to be quarantined for 28 days or isolated for 28 days? I have no symptoms and I'm going to be tested again tomorrow.
Ms. Ayers?
Now, I'm not sure where the 28 days came from. So if the person you
I even asked them to find out and come back to me and they still said 28 days.
Yeah, so if you were exposed from somewhere outside of your household, the longest you would ever have to quarantine is 14 days.
Okay, it'll be 14 days, technically on Thursday, actually. This is my
Okay.
11th day. I tested on the 5th day, which is, I'm going to test again because they said I probably should have waited to the 6th day. So I'm going to test again tomorrow. And I have not had symptoms. So I'm here to see if I can go back to work. They need people over there.
And yes, we do need you very, very much. And so I'm very happy to see you and to see
Yes,
your
ma'am.
willingness to work with us.
Yes.
So before you leave tonight, if you could just write your name for me on a note and give it to me. You know, it is clear that we need to continue to work with all staff to be consistent in what we are sharing with staff.
Yes.
We met with folks, about almost 40 people covering a lot of different areas last week. We shared the quarantine letter that the Crater Health District had approved for us. It had some critical dates in it. It sounds like we have to continue to give consistent documents.
Yes.
So we're all preaching from the same hymnal.
That's right.
So we have to own that. We may not have been doing that, and we have to do it moving forward. So that's where I am, but thank you.
No, thank you.
We need
Thank you so much. I showed up I just wanted to say that there are people here that want to be here with you guys, and I really do appreciate what you're doing for us. And it broke my heart that I couldn't go back.
No,
And I
we
want to
need
go
you.
back.
We need
Yeah.
you. We need you.
Thank you.
Thank you. Appreciate it. Dr. Duhart, was it something you wanted to say also? You're good? Okay. Is there anyone else who would like to speak? I see a lot of you all have written in the chat, and the staff have answered your questions.
I think Mr. Christian has another question.
You see another hand?
Or is that from the last?
Mr. Christian, do you have another question?
Yes, I did, but I want to thank Ms. Bell, and I'm saying this publicly, because she did answer my question. And the reason why I asked this question, because again, a lot of parents come to, because they live in our neighborhood and members of our neighborhood association. And you all know me, I'm always going to encourage that parent or parents or whomever to start at your school, your local level first, and then work their way up before any attempts to take it legally or otherwise. So because of that, I want to thank Ms. Bell, who did answer my question. So now I can further dig into that parent's grill. Where did you get this information from? So again, I want to thank Ms. Bell for answering that question. And I also, because there are a lot of times I'm very disappointed with her, but in this particular case, a similar incident came up, and I want to thank my school board member who who answered questions for a problem, and that parent was satisfied. So I just want to put that out there publicly. That doesn't mean I'm still happy about something, but first and foremost, Dr. Martin, members of the school board, you know, if anybody's going to stand behind you, especially when you're right in public, it's going to be me. And anybody who doesn't like it, then we go to fighting in private.
Thank you, Mr. Christian.
Thank you, Ms. Bell.
Okay, next, we do have an individual that signed up. Tawanna Ishmael. I do see the name on here. Tawanna Ishmael, would you like to speak?
Raised her hand.
Okay.
Can you hear me?
Yes.
Yes, hi. I think they had answered my question because I didn't understand my daughter. She's in high school and this is her first year. And she came and told me today that one of her classmates, which she said had the shield in front of her, and my daughter always went wear her mask. And she was just nervous that she had got exposed because the child was having COVID-like symptoms. So in the beginning, I was listening, and they were saying that at least they 3 feet apart and have her mask on. She's not really exposed, and but she also is fully vaccinated with both her shots.
Okay.
And Ms. Ishmael, that is awesome, and that is correct. And we put the desk shields on the desk as an extra layer of protection.
Yes, I'm also a long-term sub at Lakemont.
Oh, excellent. Thank you for your service. We
You're
truly
welcome.
appreciate it so much. Thank you.
Yes.
I would like to throw in one small little piece just so people are aware when they're doing contact tracing, the dust shield, they're super useful and really do help, catch any droplets and stuff like that. But they don't use that in lieu of the distancing. So it would still, if they're less than 3 feet, even with the dust shield, that's still considered a close contact. So don't worry that they're not taking that distancing into account, even with the dust shield, they still do.
That's correct.
Okay, is there anyone else? Okay, we will say it again.
Oh, no.
Oh, okay.
We're good.
Okay, we'll move back around. I believe board members may have some questions or comments also. Mr. Dance.
Good evening, everyone. I just had a question. Maybe somebody from the Crater District Health can answer it. Will there be massive booster shots given at locations like we did for the first and second shot? Does anybody know?
That is a great question. So we just had gotten word about the booster shots for certain populations on Friday from the CDC. So we are still working through the planning about booster shots. So sometime within this week, we, VDH will start posting out their plans for helping get booster shots for the people that meet the recommendation for that booster shot. So that will hopefully be coming out this week.
Thank you very much.
Of course.
Thank you, Mr. Dance. Ms. Long? Okay. Mr. Lundy?
Yes. I would like to, hopefully, I would like to see us be on the same page with the educational alternatives that we have so that our parents won't be confused about what we offer. I will reiterate it over and over again. Our counseling areas should all be consistent, where all of our parents can get the same information so everybody will not be as confused as they are. Also, when I got an opportunity to first speak, the first thing I taught to first speak was the first thing I spoke of was the 28 days. And I'm saying there is some inconsistency there also. And there are some parents that did not come on because everybody doesn't want to speak up, but those parents are very confused about that. The last thing I want to say that to our parents, and hopefully our parents can relate to our kids as we go through this pandemic. There's a lot of anxiety, but we need to teach one another, hopefully, and teach our kids at the same time. Am I my brother's keeper? And if we are doing that, that means that we want to do the safest things we can for one another. So hopefully in our homes, hopefully in our communities, we can stress that to each other so that we can be concerned about taking care of not just ourselves, but each other. Thank you.
Thank you, Mr. Lundy. Ms. Nguyen?
This was recorded correctly.
Correct,
So it's something we can use as a referral for things if we have questions. I'm quite sure there are going to be a lot of parents who did not hear what Ms. Ayers had to say that needed to hear what she has to say about classroom distancing, home and family track tracing and stuff like that. So that might be some way we could, make that a hard copy and just bullet, because you don't want to do a whole lot of reading, but just bullet the facts. It would help out.
Mm-hmm, mm-hmm.
Yes, ma'am.
Also with the Dr. Peachman, I'm not sure, and I guess Mr. Corey would know also, with the questions that have been put in the Q&A, are we able to take those questions and make a list to show the questions and answers so everyone can read the questions that were asked and what answers we provided, and also the questions and answer, like Ms. Wynn said, that was provided when we brought them online also?
So yes, so we have the recording, and all of the Q&A and chat can be printed. You
Okay.
even know who asked the question. That's
Okay.
on there as well. So yes, all of that can be printed, and we can actually organize it into an FAQ document, which is very often what we will do with our staff meetings. So yes, that can
Okay.
absolutely happen. And then go ahead, to Ms. Wynn's point, put it in kind of simple bullets for folks as well.
Okay.
Great.
Thank you. Mr. Pierce?
You actually took care of it just then, Mr. Pritchett, to provide this information for all of those who would like to see it in a hard copy, some relative print, and hopefully at some other time during the course of the school year, if it's possible, that we can do this again. It's always good to know that we can do these kinds of things for the parents and community that would love to be informed. And I think that's the largest impact that we can show the community. And we're not, do we always get it right? No, because we're constantly learning this process as well. And to get it right, it has to be a continuous process. That's why these questions come up. And it's only fair that we provide as much available information to the community as possible. And if we can do this again, because the more times we have forums like this, the more it becomes that much more transparent and clearer. So I would say if we can do it again at some point during the course of the year, then that would be a great thing to do. Thank you.
And
Thank you.
also,
Thank you, Mr. Pierce. Dr. Peachy Martin?
and also, Chair, when we do collect the questions, we'll run it by Ms. Ayers and her colleagues at the Crater Health District to make sure our answers are exactly what they should be based on a health professional as well at the Crater Health District. So.
And I can also type up my answers to the questions that I went over in the beginning as well, so you guys can have a hard copy of that.
Thank you. We appreciate it. Okay, I want to say thank you to everyone who attended tonight. On behalf of the school board, I would like to say that, as Mr. Pierce will echo from Mr. Pierce, we don't always get it right, but we promise that we're going to do our best to get it right. We do apologize for any confusion with the opening of schools and thus far with some of the information that was given, but we're going to make sure that we do get it corrected. Dr. Peachy Martin will be meeting with her staff to make sure that everyone is on the same playing field, that everyone has the same information, and we are sending out all of the same information to parents and citizens also, and to stakeholders. So we do thank you for joining us tonight. We will let you know if we are planning another virtual forum. We will be sending out a link and an email to let you know, but we just wish you the best success for school year for your child. And also we're asking that you stay safe and stay COVID free. And if you have any issues or any concerns, please remember to reach out to your child's teacher. If you're not satisfied with the answer with your child's teacher, reach out to the administrator of the building. If you're not satisfied with the administrator of the building, then you can reach out to the superintendent's office. And if you're not satisfied with the superintendent's response, then you reach out to the school board member. Okay, we ask that you follow that protocol when you're trying to reach out. Start out first with your teacher, with your child's teacher first. Try to get everything resolved. But once again, we thank you tonight for everything, and we look forward to seeing you around. Hopefully this thing will end soon where we can go back to normal. Okay, at this time, is there a motion? Is there a motion to adjourn?
So moved.
Moved by Ms. Long. Is there a second?
Second.
Second, Ms. Nguyen. All in favor?
Aye.
Opposed? Motion carries. This meeting is now adjourned. You all have a safe night.
Stay safe.